Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yishra Hawkins. Well, we have more on COVID-19. Of course, that hasn't slowed down. Doesn't look like it's going to anytime soon. We're going to talk a little bit about the COVID-19 vaccine rollout and, of course, what the Vatican has to say about the vaccines in regards to some of their moral stance and people being concerned about taking it because of the sourcing of how they develop these things. Food banks are struggling, of course, and notwithstanding, the death rates are continuing to soar, continuing to break records on a daily and or weekly basis. But first, we're going to start off with on December 12th, the FDA authorized the emergency use of the COVID-19 vaccine from Pfizer, calling it safe and effective, comparing the release of the vaccine and D-Day to the beginning of the end. Well, the distribution of the vaccines will prove a logistical challenge for shipping companies such as UPS and FedEx. While the distribution of the vaccines prepares to take place, record-setting single-day death tolls continue to rise in the U.S.
Well, in Portage, Michigan, at the Pfizer plant, workers pack hundreds of boxes of the vaccine. Now, General Gustav Perna, the CEO of Operation Warp Speed, said in a press briefing, "Today is truly a historic day. For 7 months, we have realized the greatest public and private partnership in modern times." Now, United Airlines had already flown in some of the shot to the United States from Belgium, transported in subarctic coolers, having to keep it that cold.
Right.
Now, the first batch containing 6.4 million doses, the first half of those delivered now, and the rest in 3 weeks.
Mm-hmm. 145 places expect deliveries Monday and 425 on Tuesday and 66 on Wednesday. The FDA authorized the vaccine for emergency use overnight, saying that the known and potential benefits of the vaccine outweigh the potential risk for people 60 and older. While President Trump is calling the rollout a miracle, everyone waits patiently as 40 million doses are expected to be delivered by the end of the month.
Well, on December 13th, vaccinations had been being administered for over a week in the UK, starting with an initial 400,000 elderly and frontline medical workers. Now, the first patient to receive the shot, 90-year-old Margaret Keenan, who also received a standing ovation at the facility where she was being wheeled through the hallways after receiving the shot. Now, public health officials are hoping her example will persuade about 70% of Britons to bear their arms. Now, most Londoners said that they will be receiving the vaccine.
Well, the global version of the vaccine throughout the globe, of course, is also underway. For example, in Asia, their version has arrived in Indonesia, which saw the highest death toll over the past week. Russia's Sputnik vaccine arrived in Serbia this week and has been trialed in Brazil, which has one of the worst infection rates on Earth. Well, even though many hope this is the beginning of the end of the pandemic, everyone acknowledges that it will still be a slow process.
Well, on December 16th, the FDA said a second vaccine from Moderna is highly effective in stopping infections and symptoms. Now, it's expected to receive emergency approval this Friday and get out 6 million initial doses, while Pfizer's vaccine is quickly being spread as doctors and nurses around the U.S. start to receive their first dose of the shot. Now, while 1,200 hospitals say that people are getting sick so quick, they are running out of hospital beds to treat them, with over 110,000 patients in hospitals in the U.S. currently. And by tomorrow morning, the hospitals say thousands will be dead.
That's right. Well, concerning the Moderna vaccine, the FDA says the vaccine is over 94% effective, 86% effective in people 65 years old and above. And like the Pfizer vaccine, is given in 2 doses. But the Moderna vaccine does not need to be stored at those sub-zero temperatures like Pfizer's. It can be stored in regular refrigerators for up to 30 days. Well, Moderna is waiting for FDA approval. New York medical staff are getting their first round of doses. At New York's Mount Sinai Hospital, Dr. Ramesh Gidwani got cheers and applause as he received his first shot of the vaccine.
Well, the same scene played out across other cities such as Chicago and Houston, but the death toll is still mounting up, with over 76% of the nation's ICU beds being full. Now, with that, in California, California's Governor Gavin Newsom is preparing for a surge in deaths. Now, Newsom said 53-foot refrigerated storage trailers are currently standing by in counties and at hospitals. We just had to order an additional 5,000 new body bags. Now, at Washington's National Cathedral, the bells had rung there 300 times for the over 300,000 Americans that lost their lives through the virus.
Interesting. Well, many medical workers have seen firsthand the toll that this virus has taken on the lives of so many from the start of the pandemic. But since the vaccine has rolled out in many of the people's eyes, they are seeing hope for the first time in many months.
Well, we're now going to turn to our field correspondent, Larry McGee, who is continuing to break down the new information regarding the coronavirus. But starting off in France, Larry, we understand that the French president, Emmanuel Macron, has now tested positive for COVID-19. What's the latest?
When experts say that everyone who meets a certain criteria are going to be located and infected by the coronavirus, everyone seems to definitely mean everyone. From the average ordinary citizen to the top leading officials in every nation, France's Prime Minister Marc Macron is yet the latest case in point, who was tested positive for the virus but is pledged to continue working during his prescribed 7 days of isolation. Elsewhere in Europe, citizens desperate for someone to blame are pointing the finger of outrage at the government. In London, in particular, numbers of people are calling for a government probe due to alleged irresponsibility and incompetence. And that, along with pressure from the scientific community, moved the British Prime Minister Boris Johnson to advise against the traditional observance of Christmas. A new mutation has cropped up among the Brits that is reportedly 70% more transmissible, and it has elicited a new round of tougher restrictions coming from the government. In Scotland, authorities are tightening down as well, severely limiting travels and gatherings. President-elect Joe Biden is uttering prophetic words warning America that its darkest days still lie ahead. By the end of the year, officials are projecting that over 3 million Americans will have died, a figure which is due in large part to those who have succumbed to COVID infection and immunocompromisation. That number will make 2020 the deadliest year in U.S. history, just as a new strain of the virus coming out of Britain is starting to make headlines. Dr. Anthony Fauci says with the rate of infection and spread that exists within the nation, the smart thing to assume is that it is already here in the U.S. As American healthcare systems continue to collapse in state after state, and citizens continue dropping dead at random. For YPN News, I'm Larry McGee. It's on Jeff. Back to you.
Yeah, I think that's the sentiment of many, with 2020 being the deadliest year. So many people have been affected in so many ways, and COVID-19 has been at the top of everybody's list, something that many would like would just go away. But of course, we know that will not be the case.
Right, and as the predictions now show, starting off 2021, it's not looking any better for this coming year.
Yeah, we'll see what the world reaps, as many have defied orders and are planning to get together for the holidays. And of course, many researchers, scientists, doctors are saying that that will cause a major increase in infection rates and subsequent deaths as a result. Well, the death rate continues to reach new all-time highs in the U.S. In fact, on December 23rd alone, more than 3,400 people died as a result of contracting the coronavirus, a new record. And another first, over 19,000 COVID deaths in the U.S. in just 1 week. Well, the death toll isn't the only number continuing to rise at an alarming pace. The number of hospitalizations across the country due to COVID has reached almost 118,000.
Well, in an effort to fight back, the United States government has agreed to purchase another 100 million doses of the Pfizer vaccine. Now, that will double the nation's supply. A little over 1 million Americans have already received the vaccine. The Secretary for Health and Human Services, Alex Azar, says by June, there should be enough COVID shots for every American who wants to have it.
Well, as Larry just mentioned, California is the hardest hit state in the country right now. Cases in the state have soared 900% just since November, as well as deaths, which have jumped 500%. One nurse there told CBS Evening News growing up in a war-torn country, he had never been as scared in his life as he is today, working in the midst of the coronavirus pandemic. Well, to give you an idea of the alarming speed the virus has been spreading, on November 1st, Los Angeles County admitted less than 150 patients per day into their hospitals. By November 26th, that number was 300 per day. And on December 2nd, it was 700 a day and still climbing.
Quite an increase.
Yes,
there.
very quickly.
Well, while it took California 9 months before it reached 1 million COVID cases on November 12th, now just 6 weeks later, on December 24th, they have surpassed 2 million cases of the virus, and deaths keep climbing as well. Now, being at the epicenter of the virus, they now have more cases than Italy and are struggling to keep up with the overload of patients. Healthcare workers are experiencing a drastic change as to what their job entails. Now, instead of helping patients get back to health and sending them home, many nurses have the painful job of putting their patients in body bags and quickly getting the room ready for the next patient.
Sad. Well, in one day alone, LA County saw 145 deaths on December 23rd. Dr. Christina Gailey from LA's Department of Public Health told CBS Evening News, "We have never seen daily rates this high throughout the course of the pandemic, and the model predicts that the worst is yet to come." Well, Dr. Gailey added, "The surge that we are in right now was avoidable." Health officials across the country had been pleading with people not to travel for the holidays, but instead to follow strict social guidelines to help limit the spread of the virus. However, many have not listened to those warnings.
Well, it fears the new strain of corona that has hit the UK hard is going to spread quickly to the U.S. New York's Mayor Bill de Blasio has ordered law enforcement in the city to make sure visitors from the United Kingdom are following quarantine rules. He said in a statement, "We're going to have sheriff deputies go to the home or the hotel of every single traveler coming in from the UK."
Well, speaking of the UK, they saw their second highest daily number of COVID infections in the middle of December. In fact, in total, it was 645,800 people reportedly have been diagnosed with the virus for the week of December 12th. Well, that figure means 1 out of every 5 people in England have COVID. Some estimates are now suggesting nearly half of new infections are from the more virulent strain that's got everyone worried even more.
Well, for those who will continue to travel, Singapore Airlines has made an announcement that they will be issuing COVID passports. While still controversial, the measure uses digital means to verify passengers have been vaccinated. Now, in a statement, the company said Singapore Airlines has started trials on a new digital health verification process. This will offer customers the ability to securely store and present information related to COVID-19 tests, as well as their vaccination status in the future.
Interesting. Well, it was the last place on Earth one would expect to hear of the virus reaching: Antarctica, a place so frozen and so remote it had been COVID-free until now. And there is not one case, but 36 cases reported to be at a Chilean military research base. A research colonel of Antarctic Affairs reported on the cases, saying 26 were Army personnel and 10 were civilians from a contract company who were doing scheduled maintenance work at the Arctic base.
Well, the base is one of 13 bases Chile controls on the frozen tundra. Now, in an interview with Al Jazeera, a researcher from the University of Magallanes, Kristen Nunez, explains how the continent adds a layer of challenges to the human body, saying, "We know the exposure there is extreme. It can have physiological effect on people because of isolation and changes in light." Now, several components that can act as an immune suppressant because of the work they do there.
Yeah,
So
pretty,
they're saying, and of course the immune system is where the virus is attacking. So they're saying they already have a suppressed or weakened immune system. Now, now you add to that the coronavirus, and it's a bad combination.
That's right. Well, Antarctica aside, there is a push in the Latin American governments to begin vaccinating their populations as soon as possible. There is a strong fear that a second, even bigger wave of the virus is on its way for the beginning of 2021. Argentina, for example, has announced their government is expecting a shipment of Russia's Sputnik vaccine within the next few days. Then their campaign to start vaccinating people just needs the green light from local health authorities.
Well, there have been many consequences as a result of the pandemic. Not only have over 300,000 people lost their lives in the U.S. and millions more have been affected, but still millions more have lost their jobs and the ability to provide for their families. Now, this has led to severe food insecurity across the country. Let's go back and look at Los Angeles Regional Food Bank for a moment. There, food distribution has risen 145% since the beginning of the pandemic. Now, donations are also up to 140%, and at some locations, they are serving 7,500 families a day. That's a tremendous amount.
Sure is.
Now, the volunteers in this line of work are also experiencing difficulties coping and, of course, keeping up with such a high demand.
So it doesn't really matter if you're in the medical field, still the COVID-19 is putting a big strain on people who are what they call frontline workers who are affected by COVID-19.
Right.
Well, Pope Francis spoke on Christmas about the need to make the COVID vaccine available to everyone. He said, "Today is the time of darkness and uncertainty of the pandemic. Different lights of hope appear, such as the discovery of vaccines. But in order for these lights to illuminate and bring hope to all, they have to be available for all. We cannot permit that closed."
Well, the Pope isn't the only one who is for the new vaccine. The Bishops' Conference of England and Wales has told its Catholic parishioners in the UK that they can receive the AstraZeneca shot without committing sin. Now, as we've reported, there has been much controversy over the COVID vaccine because it was developed from cell lines originating from an unborn child that was aborted in 1983.
Interesting. Well, the bishops have agreed that a person of faith and having grave reason can receive a vaccine sourced in this way as long as there is sufficient moral distance of time between the administration of the vaccine and the original wrongful act of murdering the unborn child. Well, the chair of Bishops' Social Justice Department, Bishop Richard Moth, stated, in the COVID-19 pandemic, we judge that this grave reason exists and that one does not sin by receiving the vaccine. So that's interesting that, the Catholic Church is against, abortion and having really anything to do with abortion. But as long as there's a long time between that child being aborted and you receiving the vaccine that is designed from the cell lines of aborted fetuses, it's okay.
As long as the murder was committed many years ago, now it's okay. But just as disturbing is the fact that they still have those cells from an aborted baby from 1983.
Yeah, that's amazing. Why research will hold on to something so long. But as we've mentioned in previous broadcasts, the people from Pfizer have acknowledged that they're not even certain about the effectiveness of the vaccine and being enabling you or preventing you from spreading it to other people. So sure, it might reduce the symptoms, but they're not sure about it reducing your ability to spread it. And one thing else that we've seen with vaccines, and many times in previous years, is that a lot of times drugs will mutate based on those vaccines. And we're already seeing a new strain of COVID-19 come on the market, so to speak. So, you kind of wonder what type of mutations are going to come as a result of what it's doing already in the people, gathering from their bodies. Now, this vaccine is coming to play. What's going to be the next step for that?
But not only the mutations that that are possibly going to come about, but also the pretty terrible side effects that some people are experiencing from taking this vaccine, the paralysis of the face, as we reported. Also, I mean, some people just flat out dying from receiving it. As we saw the one video where the nurse, she passed out after she had the vaccine. So, very adverse effects. Some people are experiencing that, but like you said, they're not even showing or proving that this is going to stop the spread. So it's kind of a shot in the dark, no pun intended.
That's right.
Well, if you'd like to learn more about these stories, please contact the House of Yahweh. When you do, don't forget to request your free copy of the Prophetic Word magazine and monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. Visit them on any of their websites by going to Yahweh.com, YisraelHawkins.com, and Yahweh'sBranch.com. You can also visit our website by going to YPNnews.com. You can email the House of Yahweh at info@Yahweh.com. And for all calls outside the United States, please dial the number on your screen. And like I said, don't forget before, as we've mentioned to you many times, don't forget the best study aids on the market for aiding you in studying the scriptures. That's the Yisrael Says and Ask Yisrael program, and you can find those by going to YisraelSays.com and AskYisrael.com.
Well, taking the vaccine and hoping it'll protect you is a gamble, but up next, Yisrael Hawkins give you the information that is 100% effective against the coronavirus. From all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.